and welcome back. I hope you've managed to have some coffees and lunch and the rest of it, and you're ready for a fantastic session where we're going to be hearing from some brilliant speakers. And this session is focusing on the role of radiation technologies in the medical management of cancer patients. Now, the first session is really focusing on highlighting the importance of radiotherapy, whilst also considering that many countries simply lack access to it. The way in which nuclear medicine plays a crucial role in providing precise cancer diagnoses and more effective treatment will also be explored, as well as the all-important cost of radiation treatment as well, and radiation therapy. Now, the Rays of Hope initiative, which is of course why we're all gathered here today, is firmly in support of member states in terms of access to both radiotherapy and diagnostic imaging. And the way it's going to work for all of the afternoon sessions is that we will be listening to 2 to 3 presentations at a time from our speakers, who have all joined me on stage already. And then I will give you, the audience, both in person and virtually as well, the opportunity to ask some questions. And please, if you do have a question, raise your hand, let it be known, make sure you're visible to me. And then if you could keep your question as short and succinct as possible, I'd be very grateful, and perhaps say who your question is specifically for, if it is for someone specifically. Lenka is sitting over there. She's waving at me now. Lenka is going to be our virtual moderator, checking on any questions coming in from our virtual audience. You can use the app in order to pose your questions. Again, I'd be grateful if you could keep the questions relatively short and also say who the question is for. Right. I think we should get straight to it. Now, radiotherapy has, of course, a fundamental role in cancer management. It's one of the most widely used treatments. First up, Dr. Sawatati Gondawiajo is a radiation oncologist at the Cipto Mangunkusumo General Hospital in Jakarta, Indonesia. I hope I got some of those pronunciations right, at least. She also serves as president of the Indonesian Radiation Oncology Society, and we're delighted she's here with us today. Thank you.
Yeah, thank you very much, Hannah. So, good afternoon, distinguished audience, excellencies, ladies and gentlemen. As mentioned before, I'm Sawatati Gondawiajo. I'm a radiation oncologist from Cipto Mangunkusumo Hospital, Faculty of Medicine, University of Indonesia in Jakarta. And thank you to all respected IAEA leadership, especially, of course, Mr. Rafael Mariano Grossi, Director General of the IAEA, for inviting me to contribute in this very important event. And it's a great honor for me to talk about the role of radiotherapy in treating cancer. So, I'm sure that all of you know already about cancer, but allow me to remind briefly what is cancer. Cancer is an imbalanced condition between the proliferation, the cell multiplication, and cell death, so-called apoptosis, due to the disturbance control mechanism of both processed by carcinogenic agent, chemical, viral of radiation, as well as the genetic predisposition. With the impact, there will be increased number of abnormal cells with the malignant behavior, which we call it as cancer, due to uncontrolled growth of the cells, with the capability to grow not only in the local area of origin, but also in the regional lymph node, as well as in the distant organ, brain, lung, liver, bone, when it travels through the limbs and vascular vessels. This condition is harmful for survival of life of the patient. So, is cancer getting close to us? I'm afraid the answer is yes. Since the global cancer burden is significantly increased, you can see here the increased number of new cancer cases from 12.6 in 2008. It can reach almost 30 million people in 2040. So it increased around 2.5 times, and it's ranked right now as the first and second leading cause of premature deaths in the age of 30 to 69. And we can see here that any 1 second there will be one person diagnosed with cancer, and any 2 seconds there will be one people death due to cancer. That's why it is mentioned now that cancer is the most leading the most leading disease in the world. And 70% of this will happen in low and middle income countries, where only 5% of global spending of cancer goes to LMIC. We have a shared common goal, actually, is the target 3.4 for the SDG Sustainable Development Goals to reduce the mortality of non-communicable disease, including cancer, by 1/3 in 2030. So, what is radiotherapy? We know that radiotherapy is the treatment using the ionizing irradiation, the X, gamma, or proton ray that will deliver to a part of the body where the cancer is and its potential to kill the cancer cells. And it is produced by the equipment so-called the linear oscillator using the electricity or cyclotron, or also come from the natural nuclear resources. And it's a very important, and it's very interesting, trusted literature by Professor Michael Barton and the team from Australia, mentioned that the RTU, the radiotherapy utilization rate, is around 50%. That means 50% of all cancer patients need to be treated with radiotherapy. So, radiotherapy is an important role in the treatment of multimodality cancer. It's clear already, beside the systemic and also the surgery. And here showed us the wide type of cancer that have to be treated with radiotherapy. Besides what we said before, that's the reason why more than 50% of the cancer patients need to be treated with irradiation. But unfortunately, inequality in radiotherapy access globally is right now exists. We can see the red bar is the new cancer cases and the blue bar is the availability of radiotherapy services. We can see what is the difference between in low middle income countries as well as in the high income countries. In the low middle income countries, the red is higher, but in the high income countries, the blue is higher. Even this also another interest publication also from the Professor Michael Barton, from Mary also here. Mary is here, is also written this literature. If we close the gap between what we have and what we need in the field of radiotherapy, so we can save 20 million lives. And also there will be a very huge economic benefit. It's reached $278 billion US. It's amazing. So what have to be done is to involve the radiotherapy investment and plan inside the National Cancer Control Program or National Cancer Control Planning from the very beginning, even from the pre-planning and in all phases of the process, just to make sure that the National Cancer Control Program is comprehensively and effectively as a whole. So this is the theory of change for radiotherapy program was developed by the IAEA, showed that as well that radiotherapy services in investment is an important intervention, which will lead to increase the lifetime and quality of life, and eventually there will be an economic benefit for the country. But before radiotherapy can make a significant impact in our world, it needs our help, because that's the most important. We need our support, political commitment from the high-level government. Why? We can see here, if we see how the difference between when we manage the communicable compared with the non-communicable disease. In managing communicable disease, controlling transmission is the key. Once method of transmission has been identified, controlling the disease becomes a matter of controlling transmission, eliminating route of the spread of the disease. Of course, this is not always easy, as we have seen with the COVID-19 pandemic, but we have seen that the world has been making huge progress. But how about in a non-communicable disease? Major risk factor has been known for years. The world has been working on it for decades, much longer than it is for the COVID pandemic. But the progress is very slow. The risk factor consists of a long list of conditions overlapping the interests of industry, transnational, national, politician, broker, media. So, to control it, a big political commitment are needed, much bigger than we have for COVID, and sustain much longer time. So as a conclusion, it is clear already that the number of cancer is increasing constantly, and the shared common goal is, of course, to reduce 30% premature mortality by 2030, and radiotherapy is more than 50% cancer patients need to be treated with that. But inequality of radiotherapy service exists, especially in low-middle income country, where half of the cancer patients who need radiotherapy don't have any access to it, and investment in radiotherapy is a must and necessary. Investment in radiotherapy is not only save life, but bring economic benefit. The evidence is real. It should be involved in the National Cancer Control Program. So it needs our support, commitment from the government, because without it, it will become only a paperwork. So the partnership and resource mobilization modalities have to be done. And as a radiation oncology professional from the developing world, I strongly believe that IAEA Ray of Hope initiative will make a difference. Thank you very much.
So, Atati, thank you very, very much indeed. Now, the next two